Hey guys, how's it going? Right now we're going to do a quick video on wound packing. We went over tourniquet application in our bleeding control and shock management, but this is a skill that takes a little bit of time. Tourniquets are pretty easy to put on to an extremity. You slide it over, wrench it down, and start twisting. When it comes to wound packing though, this is a skill that takes a lot of practice, and it's not like riding a bike, right? So constant uh, training on this is going to be important. Now, where do we wound pack? So unlike tourniquets, where those are for the extremities, wound packing is for areas that are not large open cavities like the chest and abdomen that we cannot fit a tourniquet on, right? So that's going to be like our groin here. We got our shoulder pocket, in our armpits, and then in our neck. Okay, and there's some special considerations that we're going to go over with the neck, but we'll cover that a little bit later. And then we're going to talk about pressure dressings real quick, because I'm going to reiterate this several times. Wound packing is all about pressure, right? It's not about absorbing the blood. It's about getting that direct pressure up against that artery or vessel that is exsanguinating. So first thing we're going to do, obviously, we're going to make sure we have the proper PPE. We're going to want gloves, maybe even face shield, something like that, to keep us safe from bloodborne pathogens. And then we're going to want to expose that area, right? So just for demonstration purposes, I have this little trainer on top here, but what we would do is we would cut this clothing away enough to where we can see where the penetration or the puncture is at. Once we do that, we're going to open that up, and we're going to, if there is blood pooling, we're going to move some of that pooled blood out of the way. That way we can see the source of the bleed. All right. You could have a very large laceration, but the artery is actually punctured in a very specific spot. Okay, so, and for this, I'm using just regular Z-folded gauze. What I'm going to do, I'm going to sweep out the pooled blood. I'm going to insert my finger and find the source of that bleed, right? And generally speaking, it's going to be kind of towards the heart, because that's the way the arteries run. But there's not anything saying that it could be in a different location. We don't know which direction the penetration is going. So we're going to find that source of that bleed, and then with our finger, we're going to put direct pressure up against that. We're going to imagine that we're trying to pinch off that artery so it's not, so it's no longer bleeding. Then what we're going to do is we're going to take our gauze, this is just regular gauze, and we're going to make a little ball on the end of it. This way we have something to put direct pressure up against. Once we do that, we're going to slide that in the hole following our first finger, and we're going to replace it with that ball of gauze, putting that direct pressure. And then what we're going to do is we're going to continue to keep that direct pressure, and we're going to fill the entire cavity, okay? It doesn't matter how big the hole is. We're going to make sure that we get that completely filled, and we're going to keep filling, and dependent on the size, we could use this whole roll, okay? And we're going to keep packing and packing, keeping in mind and double checking to make sure that we don't have any blood oozing around the edges or soaking through the gauze, because remember, it's not about absorption, it's about direct pressure. And if we see blood oozing around or coming through, we've missed the artery and we don't have the pressure in the right location. So then we're going to have to pull our gauze back out and start over, making sure that we have it in the right location. All right. Once we get that packed in, we're going to want to go above, we want our packing to come above the level of the skin. All right. And the reason for this is we're going to take and we're going to put firm direct pressure right here. And we're going to hold this direct pressure. And I'm saying you're pushing hard on this. You're not being gingerly about it. With non-hemostatic gauze, you have to hold this for 10 to 15 minutes to kind of allow the clotting factors in the blood to kind of start to take effect. Okay. If you're using hemostatic gauze, something like Celox or Combat gauze, 3 to 5 minutes. All right. And at that point, we'll be able to start applying our pressure bandage. Right. We're still going to keep pressure on it, but it's not until this point and confirming that we don't have any bleeding coming around or soaking through that we can start with our partner being able to put a pressure bandage on this. All right. Now, pressure bandages can be several different, there's commercial pressure bandages and things like that, but a lot of rural departments, stuff like that, don't carry things like that. But something they do carry, and we're going to go ahead and assume that I've held this and there's no bleeding that's soaking through. What I'm going to do is I'm going to have my partner take over direct pressure here, and then she's going to go ahead and hold that pressure while I get my pressure bandage set up. All right. In this instance, something that works really nice, this is just a SAM splint, okay? That's been tightly rolled up. I took it out of the packaging and I rolled it up tight. And then I have 2 cat tourniquets, and I've looped one through the other and Velcroed onto itself, so I've made it extra long. All right. What I'm going to do is I'm going to take this SAM splint here, and then I'm going to go ahead and replace my partner's finger with this SAM splint. And then she's going to put direct pressure on that again while I'm feeding this through here underneath your patient. And it's important with this that I get the windlass close to this pressure bandage here, because I want that direct pressure going straight down into that. I'm going to imagine I'm already putting a lot of pressure here. I'm going to get as much Velcro activation on here as I can. All right. At this point, we're going to go ahead and line things up, make sure we're getting that direct pressure in the right spot. And then just like we do with our extremity, we're going to twist this windlass until we have that direct pressure. We're going to put this over the top. And then we're going to want to immobilize this patient, because we don't want, in the movement of this patient, say we're taking him from maybe outside of his vehicle, inside of his apartment, in the grocery store, wherever this has happened, while we're moving this patient, we don't want this to come loose, right? Because then we have to start all over. All right. Something else that's important to note is while you're holding that direct pressure for whether it's 3 to 5 minutes with Combat gauze or the 10 to 15 minutes with regular gauze, this is when your partner or the rest of your team is going to be doing a rapid assessment on the rest of the patient. Care doesn't stop while one person's doing one thing, right? Multiple people can be doing multiple things at the same time, right? So this is a good and effective way of packing a wound in the groin of your patient. And this can be anywhere. It could be inside, in the inside of the thigh. It could be on top, right? But the important thing is getting that direct pressure up against the source of the bleed, okay? Right. What's that?
Against the bone.
And pushing it up against the bone, because remember that direct pressure, it's going to do the same thing a tourniquet does in essence, is it's going to pinch off, it's going to push that artery or that vessel up against the bone, and it's going to occlude that bleeding. So that's what we would do with something in the groin. All right. Now, like I mentioned before, same thing with the armpit, same process. We're going to find that source of bleed. We're going to pack it, fill it up. With the pressure bandage, however, we're going to go around the neck and under the armpit. And it's the same with packing of the neck and the armpit, same type of pressure bandage. But like I said, there's some special considerations when it comes to wound packing the neck. All right. So with wound packing the neck, we got several things kind of going on. Because while stopping the bleed is important, we also have to make sure that we're not occluding the airway, right? We have our trachea right here that are carotid and our jugulars are on. Okay, so when we're packing the neck, we don't want to go to the side up against that trachea, but imagine going back towards the cervical spine. Okay, now once we've gotten that done, something we have to remember is we don't want to inadvertently cause any sort of air embolism. Okay, because if we have a puncture to our neck in the artery, there's nothing saying that the jugular is also injured, right? So, and there's really no space between the neck and the chest cavity. If that object went at a downward angle, it could be the same thing as a sucking chest wound, all right? So once I've packed this wound, and I'm just gonna have Miss Cherry hold this up against there. I've packed that wound, again, pushing back towards the cervical spine. I've held that for 3 minutes with hemostatic or 10 to 15 with non-hemostatic. What I want to do before I apply this pressure dressing, and if I had another partner here, I'd have them holding this pressure. I would take an occlusive dressing, and that could be a commercial grade, same thing you'd use for a chest seal, or it could be the plastic packaging that your gauze comes in. But you're going to put that over the top of that dressing, right? And then you're going to tape the sides, okay? That's impeding air from getting in, right? Then you're going to take some sort of bandaging, right? It could be an ACE bandage, it can be rolled gauze, right? This needs to be elastic, right? Because we don't want to cut off airflow when we do this. So with this gauze here, what I'm going to do is while my partner's holding pressure, I'm going to put this here, and then I'm going to have my partner or the patient, if they're able, to lift their arm up, right? I'm going to go below, I'm going to come over the top. Now what I'm going to do is I'm going to alternate from side to side over this loose end so I have something to tie to later. And then I'm going to tie this off. And then what this is going to do is when she lowers her arm down, it's going to pull and put pressure up against that source of that bleed right there, okay? So we've stopped the bleed, we've got direct pressure, and we've stopped any sort of ability for an air embolism to get in by putting an occlusive dressing on. And it's the same exact process with the armpit, except for the hemostatic gauze is going to be, in the armpit, right? But still the wrapping is going to be the same, okay? So that's what we do for junctional bleeds. And so go ahead and practice this. You can use all kinds of different things for trainers. Let me get this off the cherry here. You can just buy a pool noodle, cut a couple feet off of it, put a hole in the side of it, and just practice packing that way. And in class, we're going to go ahead and go over it a little. We're going to let you guys go over it and actually get some hands-on training with it. But at least this way, when you get to class, you know the process of packing a wound. It doesn't want to stop.